Greetings to all my students, 100 level students of Nasarawa State University, KEFI, Department of Guidance and Counseling. I am Dr. Mrs. Iya Haruna Ayuba, and I'm just about teaching you the course, Counseling Techniques and Practice. The course code is GCE112. By counseling techniques and practice, we shall be considering the following course outline. First is an overview of the course, then the meaning of counseling techniques, types of counseling techniques types of counseling techniques, then the counseling process itself, what does it entail, the stages of counseling, qualities of effective counselors, and common problems of beginning counselors. By way of introduction, the field of counseling becomes relevant only when theory is translated into practice. This is achieved by attempting or by adopting certain counseling techniques, strategies, or methods used in counseling to communicate whatever the counselor has to his clients. So all that we'll be doing in this course is to equip students with the knowledge of those strategies and the techniques that they need to have, because those are the things they'll be using, the methods they will be using in interacting with their clients. We have quite a number of them, and this course promises to take students through this. It is your first year in the university, and it is important that all students get to have adequate knowledge of what these counseling techniques are, so that as you go through your course in the university, you'll be able to practice them along the way and have some level of mastery before the completion of your program. Counseling techniques. What is counseling techniques? I like to define counseling techniques as those skills expected to be mastered by trained counselors as tools used during counseling interview for effective service delivery through effective communication between the counselor and the client. So it is one thing to know what these counseling techniques or strategies are, but it is completely another for the counselor or the trainee counselor to get to understand their usage with some level of mastery. That is very important, because it is expected that we would have learned these techniques with some level of mastery, so that in your day-to-day interactions with clients, you will be able to use them without difficulties. Counseling itself is not a is a process that involves quite a number of stages, and scholars in counseling have developed several stages through which counseling can be administered. Some have developed 4 stages, some 3, some 5, some have it as 6, some 7. All these are tending towards the same direction. The counseling process is the same. So whether a scholar summarizes the stages in 3, or they are 4, 5, 6, or 7, whichever method scholars decide to use, fine. In this course, I would prefer to adopt the 6-stage model of counseling. In this very model, the counseling stages are presented in 6. You have from stage 1 to 6. The first stage of counseling is the relationship building stage. It is a stage during which the client is believed to have stepped in to meet the counselor for the first time. So if the client is meeting the counselor for the first time, there is an environment that he or she is expecting, a friendly environment, an accepting environment, an accepting counselor that shows some level of friendliness, that the client feels comfortable to be able to work with that counselor. So that first stage is relationship building stage, and that is when it is a stage where you ask, the counselor gets to ask for the client's names, where he or she is from, and certain details, very important, vital details about the client, so that he or she gets to know the client better. It is after that stage that we get into stage 2, which is the assessment and diagnosis stage. The diagnosis stage is that level in counseling where the counselor is believed to have familiarized or established rapport with the client, and after which he gets to involve the client until he gets to know what exactly the problem is that brought the client to the counselor for counseling. So the diagnosis stage, at the diagnosis stage, the counselor is expected to do a lot of assessment. Sometimes when clients are talking, they may not be straight. It's not all problems that clients are able to say at a go. Some of them will go left and right, saying a lot of things. You have to be able to pick the real problem from all that the client is saying. That is very important. So after the relationship building, the rapport stage, the next stage, stage 2, is to assess and diagnose what the problem is. Once the problem is identified by the counselor, the next thing is stage 3, and that is formulation of counseling goals. At this stage, it is expected that since the problem has been identified, then go ahead, the counselor and the client, and map out how you think that these problems can be resolved. So what do you want to achieve? Set goals that you can achieve. A client has a problem. How do you go about the problem? In setting goals, the client must be involved. I'm trying to say that simply because I am a counselor does not qualify me to set goals all on my own and present them to my clients to ensure that he carries them out. No. The client is responsible for setting this goal, just that the counselor is supposed to guide the, the client into setting those goals and make sure that when goals are set, let them be goals that can be achieved. Let them be achievable goals, not goals that you set and you discover that there is no how you can get around them. The fourth stage is intervention stage, or some people call it problem solving stage. It is a stage where the client and the counselor get to implement what they have said they want to achieve. Remember, they've identified the problem, they have set goals. Now they want to make sure that all they said they want to achieve is truly achieved by way of implementation. So at this stage, is there anything that the client needs to do to achieve those goals? Then he or she should go ahead and do that. Stage number 5 is the termination and follow-up. By termination, it means that the whole counseling process is being brought to a close. Counseling is not closed if goals have not been achieved, if the problems identified have not been solved or resolved, then there's no how you aspire to just terminate counseling. So this stage comes when problems have been resolved, successfully resolved. And once they are resolved, that means that the problem that brought a client into counseling no longer exists. For that reason, sessions are brought to close. The whole process is ended. And once it is ended, the counselor goes ahead to do what is called follow-up. It means that the client may not report for counseling consistently as he used to, but time to time can check on the client to be sure that the client is doing well and is succeeding in his new phase in life. Then the last stage is research and evaluation. The question is the client faring well? How is he doing after counseling? Is he able to stand on his own or he still needs help? Very important. So these are the stages. Like I said, different scholars have different stages, some 3, some 4, 5, 7, like that, but we have decided to adopt the 6-stage model. So whichever one that one finds to use, you will discover, even if you are using the 3-stage model, you will discover that all of these points that we have discussed are embedded. The next thing we'll be talking about is types of counseling techniques. Types of counseling techniques. I've defined counseling techniques as those methods and those strategies that a counselor needs to learn or to understand with some level of mastery to be able to administer counseling to clients. There are so many counseling techniques that counselors adopt. And some of them are questioning. Another one is active listening, communication, empathy, silence, summarizing, paraphrasing, interpreting, and the rest. There are quite a number of them. For the purpose of this class, I'd like to discuss very briefly questioning. We use questions every day as individuals, but as counselors, we use questions with understanding. And what is questioning? What is questioning? We get to use questions every day. We ask people questions. They are statements we make that actually require that the person we are directing them at are able to give us a response as feedback. Broadly, there are 2 classifications of questioning. Questioning can either be open-ended or it can be closed-ended. And I describe open-ended questions as those questions that one may ask whose answers require a whole lot of explanations. So you ask a question and someone that is listening to you or the person that is expected to answer has to give explanation, then it is an open-ended question. On the other hand, the closed-ended questions are those questions that you ask someone or you direct at someone and the answer is just one word or yes or no. So those kind of questions that are close-ended, whose answers are either yes, no, or one word, do not give you the information you require as a counselor. You need to do a lot to be able to generate information from clients. So it is encouraged that yes, though you cannot shy away completely from close-ended questions, because there are times that you must use them, it is encouraged that we find a way of using open-ended questions with our clients. They are friendlier to use. So when we are asking questions, we don't just ask questions as counselors for asking sake. We ask questions either because we want to generate information. We ask questions because we want to seek clarification. We ask questions sometimes as a sign of disapproval. They are rhetorical, but they show disapproval. So there are several guides that we have as counselors when we use questioning as a technique. We also say that when you are using questioning as a technique, be mindful of how you use it. When you ask your clients too many questions at a go, the person becomes scared. Your clients become suspicious. Instead of opening up, they barricade. So as much as possible, where it is encouraged that you ask questions sparingly. And when you are asking questions as a counselor, ask questions with the right tone so that the message will be conveyed and you will get required responses. So that is it about questioning. There are a lot we can learn about questioning, but that's the little I would say about that. The next thing is active listening. And what does it mean? To listen actively is to listen, to pay attention, to give rapt attention to whoever is talking to you as a client. If the client is before you, it is expected that your attention will be on the person, that you will make sure you keep off all forms of distractions so that whatever the person is saying, you are picking, you are understanding. Sometimes when you give clients the opportunity to express self or to tell you what brought them to counseling, they find it difficult to even articulate. So instead of telling you straight, I have difficulties with my academics, the clients may go, I don't even know where to start. Um, I'm not doing well in my academics, you get that kind of thing. So it is for you to go in between lines to pick the information. If you're not listening actively, then you will not pick the information. So in order to listen actively as counselors, phones must not be distraction to us. Other persons must not be distractions to us. Whatever that can draw our attention, we must keep off. The next skill is communication. Communication is said to be two ways. So you are with someone, you talk with someone, and the person talks back. It is two ways. There are different ways people can communicate feelings, they can communicate thoughts, they can communicate ideas through communication. I mean, by expressing self. And so, in expressing self, people can do that through different ways. We understand communication to be verbal and non-verbal. The use of words is verbal. As I'm talking now, it is verbal. But I can use signs and I can use gestures to show that I'm saying something. In counseling, we encourage that our students will get to understand the different ways that clients package their information. Sometimes you discover that they may be saying something, but what they are saying is not in sync with what they are displaying. So it is for us as counselors to understand the different ways people can communicate and take advantage of that knowledge and understand correctly what they are trying to pass across. Empathy is another technique in counseling. And each time I teach this to my students, I say this. Until a client is able to see in you, the counselor, that you truly have understood him or her, you are not empathizing. I say it again. Until your client is able to tell by looking at you, the counselor, that you truly have connected and understood his problems, you have not understood the problem. I hear people say, I understand, I get what you are saying, but that isn't it. Simply because you tell a client, I understand what you mean, does not convince the person that you get to understand truly what is happening to him or her. So empathy is bringing yourself to that stage of understanding of a client's problem to the extent that the client himself or herself understands that you truly understand their problem. Not many people are able to do this. Sometimes some people may fake to understand. In fact, it is commonly defined, empathy is commonly defined as being in another person's shoe. But I would like to go with my earlier explanation. Understanding a person's problem and feeling for the person to the extent that the person himself can pick in you that you truly know what he or she is going through. It is a skill. You don't get to master it from the scratch or as you just start. It is you practice it as you relate with people. Silence is another skill. And again, I hear my students say silence. They are surprised that silence is a skill in counseling. Yes, it is a skill in counseling, and we practice to use it as counselors with our clients. Silence means being quiet. On one hand, from the part of the client, the client can be talking with you, the counselor, and all of a sudden, be quiet. It means a lot. When your client is quiet in the midst of a discussion, then you know that something really hard is happening in him or her. Because the person was there to discuss, and if all of a sudden the person stops talking, then expect the following. The person is going to weep. Is it that the person is going to weep? Or the person is trying to adjust what he or she should tell you? Or the person is not comfortable telling you whatever is there that is making him to be quiet. So you as a counselor must know what to do when your client is quiet. When your client is quiet, you don't jump in immediately and start, talk now. No, take it easy. When you use this skill wisely, then you are able to win the client's heart in the sense that he goes quiet and you may check to understand why this person is quiet. Many things may be going through your mind. He is quiet, you'll be quiet for some seconds, but you encourage the person depending on the non-verbal communication that is going on. Quiet, yes. Weeping, then you may help the person, encourage the person by giving the person tissue to wipe face, or you may even go ahead to say sorry and say things that will encourage the person to continue talking. But at this stage, you don't hurry the person up because the person needs to brace up to talk back again. So when you're able to use silence properly as a counselor, then your counseling will be successful. But if you're not careful and you use it wrongly, you are likely to lose the clients. The next thing is summary. And each time I want to talk about this, I tell my students for ease of understanding that summary is the same thing, the same way you understand summary in your English class. That is how it is here. You want to summarize, you don't summarize when there is nothing. You only summarize when a lot has been done. So summary as a technique comes at the end, towards the end of your counseling session, when you go through from the beginning what transpired that day between you and the client. Just before you end that session, you go through it again. This is the problem you presented today. This is what we discussed. This is what the goals we've set. These are the ways we agreed you will go on achieving your goals or implementing them. This, you bring everything. You say in brief, in few words, all that transpired. When you do that, you are helping the clients to confirm, and you are helping yourself to establish whether the understanding you have is correct or not. So the client leaves that place, even if there are key points or assignments or tasks that he or she was supposed to do, the person did not quite note them at the time you mentioned them or you were discussing them. When you are summarizing, the client gets to take notes and work with them. Paraphrasing is another technique, and paraphrasing is very close to summarizing, but they are not the same. These two are not the same. While you do summary towards the end of your counseling session, paraphrasing comes in between. You know, it comes as your client expresses self. Sometimes it takes them a long time to try to articulate. They may have used 10 minutes just trying to make one statement. So after saying a lot, because they can bring in a lot of things along the line that may not necessarily be a problem to them. What is a problem to them is just one thing inside. So you paraphrase, you reduce the number of words, you say what they have said, but this time around in one sentence or two. That means you have thrown off the junks and you are working with just the keywords. This will help so that you are sure that this is what the client means and you don't leave that place with the wrong information. Interpretation or interpreting is another skill in counseling. And what is interpreting? I've told you, I've said this several times already, that there are clients who do not know how to articulate their points. And until you, as a counselor, is able to understand this, to know that yes, this is what they are saying, you will leave with a wrong information. I've said this and I've said this to students. I said in the year 2020, during the COVID year, there was this video that went viral. Let's assume that that pupil was my client, let's say in the primary school. Looked like a 5-year-old, a 3, 4, 5-year-old girl who said to her uncle or somebody close to her that there was coronavirus in her mouth. And he said, what? They spoke in Hausa dialect. And she repeated, there's coronavirus in my mouth. And he said, what are you saying? And she goes, when I eat food, I feel it painful in my gums. We are talking about interpretation or interpreting as a counseling skill. Now, to that client, if that was a client, she simply explained based on the environment. As far as she was concerned at year 2020, no disease, no virus existed. Every form of illness was interpreted as coronavirus to that client. So people watched that video and they laughed over it. But I knew that that client was trying to say that something was really wrong with her gums or tooth. So until you are able to interpret what a client is saying properly, you are likely to miss his point and the real thing that brought him to counseling. So we can master all these techniques. There are many more techniques that time will not permit me to discuss here, but these few that I have discussed with practice will be able to master them, and I encourage our students to do so. The next thing that I would like to discuss is the qualities of effective counselors. It is not enough to know counseling techniques with some level of mastery. It is important, but your counseling will be a mess if you lack effective qualities that will make that counseling effective. And what are they? One is being trustworthy. Being trustworthy. It is expected that as students, You are just beginning your first year. Get to know it and know this early, that it is expected of you as a counselor to be a trustworthy person. Can you be sincere? Can somebody trust you? When you say things, do you keep at what you said? Or you say them and then you don't care what happens, you can just change your mind anytime, anywhere? No. As counselors, make sure you are trusted. And if you have not been, then you can begin to start learning to be a trustworthy person. The next thing is to make sure that you are confidential in your dealings with your clients. And to be confidential is to show a sense to be responsible in protecting your client's information. If your clients wanted their problems announced, they would have gone to radio houses. But if they do come to you, then do everything to protect them and protect their information. Although I know very well that when we are talking about confidentiality, there are instances where confidentiality can be breached. This is especially when there is threat to life, when the person is threatening to take his life or threatening to put some other person's lives at risk. One other reason is when you are dealing with minors, with people, with children, people who are underage, then you will need, or it will be expected of you to share relevant information with relevant stakeholders. But it is not expected of any counselor to make a broadcast or to just share information freely with people because we have the privilege of knowing them. The next quality is for counselors to ensure that they are empathic. I'm sorry to say that there are people whose disposition show that they are not bothered about anything. And then you see other people and you see how connected they feel when someone is in trouble or when someone is not comfortable. They want to help out. And it will not be good for a counselor to say, it is my nature not to want to help. No. It should be part of us. It is a quality. You should be able to communicate some level of empathy to the people around you. Then we have confidence, having a sense of boldness. I don't want to believe that a counselor will succeed and succeed well if he or she does not know what to do. Being confident of what you are doing attracts. So if you know what you are doing, then do it well. It comes with boldness. You'll be enthusiastic if you know what you are doing. The next thing I want to discuss close to that is being knowledgeable about what you are doing. If you have to be a counselor that will succeed and be effective, then you need to know. You need to be aware, you need to be educated, you need to read books, you need to read materials, you need to watch videos. You have adequate knowledge of different areas. That way you will be able to help your clients, because a client can decide to book appointment with you and tell you, I'm coming tomorrow. Yes, beautiful, that happens. But let me tell you, what and how a client will present his problem is never disclosed to you. So it comes abruptly. He's sitting before you and he's telling you his problem the way he wants. You don't you don't have a prior knowledge of his nature of presentations. And that is why you must have knowledge, so that you'll be able to maneuver and help your clients appropriately. Also, effective counselors are counselors who are non-judgmental. They listen to their clients, and whatever it is, they don't pass judgments. I keep saying that to pass judgment or to be judgmental is when somebody comes before you. Let's assume as I'm in this office now, someone comes and I see the person crying, let's say it's a child, the person comes in crying. Without hearing from the person, I go, maybe I tell the person, I know you will always go and look for trouble. Now you have looked for trouble and they've beaten you. That is being judgmental because I have not even heard from the person. So this is an attitude that is not expected of any counselor. Every client is expected to come, give the person the chance to express self, and never serve as a judge to the client. Be creative. Creativity is another important um, important quality expected of counselors, practicing counselors. And what does it mean to be creative? To be creative is to be versatile, to understand your field, to understand your profession, to understand how to attend to problems and people with some level of diversities. If somebody comes before you and is bereaved, for instance, and you use a particular method to attend to the person, maybe you just spoke to the person, you used modeling, and it worked. Don't expect that because you used modeling today with someone who is bereaved, that another person who comes tomorrow, you will apply modeling and it will work, it may not work. It may not work. So people are different, people are going through different challenges. So even if they present with similar or the same problem, their diversities may not allow that one method will work for them. So you have to be creative, understand the person's likes and dislikes, and know how you can maneuver in helping the clients. The next thing we want to talk about is common problems of beginning counselors. I'm talking about counselors like 100 level students who have just stepped into the university and are going through these lectures and are already feeling in their minds that they are counselors. Yes, you can start, but beware of the following problems that cuts across people who are just beginning in this field. There's that tendency, number one, there's that tendency for them to attempt to render counseling without anybody soliciting for it. They want to help. They want to rescue. They want to rescue. Sometimes it is important, yes, that you see an area of need and you want to help, but you should also be guided to help, render help the right way. The other problem is for them to have the tendency that they want to practice a particular skill and learn it so well to the extent that anybody that comes to them as a client, that is the skill they are using. Maybe they will look for the simplest skill and all the time they are using that skill. I know that there are skills that you cannot do without, but every skill is important. So the tendency for beginning counselors to overuse one skill is there, especially questioning. They begin to question everything they say to the client is a question. So that tendency is there. So I've talked about the eagerness to rescue or to assist a client. There is also that tendency for beginning counselors not to be able to diagnose what the problem is. That after a client has sat before them for quite some time and has discussed his problem, they do not know, they can't tell exactly what the problem is. They are unable to diagnose problems. They get too used to one theory that they want to use and they cannot change because it is simple for them. These problems cut across beginning counselors. Some of them get too emotionally involved when it comes to attending to clients. A client comes and discusses his problems, and the person that is supposed to be the counselor starts weeping from there, and goes home, is unable to coordinate, is still weeping because he's thinking about what the client has said. All these are tendencies, are problems we consider that are common with beginning counselors. Beginners also find themselves rehearsing what to say when they are before their clients. So as the client is talking, instead of them to pay attention to what the client's lines, they are practicing and looking for which strategy or technique to use to attend to the client as soon as he's through. So this and many other reasons can constitute problem for beginning counselors. I know I have taken time to explain all that we have in this course. We have talked from the beginning to this point, and what, in conclusion, I would like to say that as beginners, 100 level students, begin to study counseling techniques one after the other. And in your day-to-day interaction with your classmates, with your roommates, with your family and friends, learn to apply them. As you do that, you will get to understand their usage better. So as a counselor, if you know theory very well, the whole essence of this course is so that we will be able to translate theory to practice. Because it is counseling techniques that we will use in translating theory into practice in the real world. And so if you know theory so well and you do not have the knowledge of counseling techniques, then you will not be able to effectively conduct counseling in the real life situation. I look forward to your questions in case there are any. Thank you very much for sparing your time